Cool. All right, let's get started. My name is Jay, and I'm one of the expert OET teachers at E2 Language. Thanks very much for coming along. In this live class, lesson, whatever you want to call it, we're going to look at OET speaking in depth. I'm going to show you exactly what the examiners are listening for in your OET speaking. I'm also going to show you basically I'm just going to show you what you need to do to maximize your scores. At the end, for the people in this webinar, I will give a Q&A on all the different aspects of OET. So let's get started and start to think about OET speaking. The first thing I want to do, because, well, speaking's not just theory, I want you to do it. Let's do a warm-up activity. What I want you to do is read this text aloud. I'm going to give you about let's say 30 seconds to read it once, and then I want you to read it aloud. So your 40 seconds preparation time starts now. And then in 5, 4, 3, 2, 1, read it out loud one more time as clearly as you possibly can. Start now. In 3, 2, 1, and you can stop. I'm a big fan of reading aloud. I think it's an excellent practice that you can do to improve your pronunciation, your fluency, start to think about how particular words are pronounced. It's a good warm-up activity. So maybe before your speaking test, you might want to grab a magazine or a book or something, maybe a medical text, and just read it. Well, people might think you're a bit crazy if you're doing this in public, but just in a whisper, read it to yourself, because there's a big difference between reading silently in your head and actually moving those muscles of your mouth, okay? So it's a good practice. I'm just going to read this for you just to give you an idea of the sort of flow that you should have when you're doing OET speaking. So I would read it like this. The Mediterranean diet is associated with a variety of health benefits, including a lower incidence of dementia. Now, researchers have identified a specific ingredient that protects against cognitive decline, extra virgin olive oil. In a new study, the researchers show that consumption of extra virgin olive oil protects memory and learning ability and reduces the formation of amyloid beta plaques and neurofibrillary tangles in the brain, classic markers of Alzheimer's disease. You know, it's obviously in OET speaking, you're going to be speaking, not reading, but it's still good practice. Just getting the emphasis right, hitting the word stress. We'll have a little bit of a look at that later. Let's continue on. We're going to do another warm-up. This time, what I'm going to ask you to do is listen to this patient speak and write down 3 questions. Now, in OET speaking, you can take notes if you want. Actually, you can use it on the card. You can take notes. I don't really recommend it because usually the patient's speaking quite in short statements. You don't need to take notes. But I want you to take notes here because I want you to really listen. Although OET speaking is about speaking and you're being evaluated on your speaking, you are also incidentally evaluated on your listening skills, because you're listening to the patient intently, then you're speaking, listening, then speaking. If you're just focusing on your speaking, you will get a low score. because you are graded on how well you understood the patient's concerns and symptoms and whatnot. So listen carefully to this patient. I want you to think of, as you're listening, think of 3 questions and write them down. Here we go. How am I going to do this, actually? I don't know if you're going to be able to hear this. No, you're not going to be able to hear that. Let me just act. Let me try and do this, okay? I'm just going to speak. You take notes. I'm the patient. Here we go. Yeah, so I've been just really tired. I go to bed at a pretty reasonable hour, usually about 11 p.m., but I just can't sleep. I toss and turn. I read my newspaper on my phone. I sort of sit up until about 4 a.m. Then I get a couple of hours sleep, and then I have to get up and go to work. And it's probably caused by work stress. When I'm in bed, I can't sleep because I'm thinking about my job. I'm a lawyer, so I've just got a lot on my plate. I'm thinking about all this sort of stuff. But yeah, it's a bit of a problem at the moment. Cool. So, sorry, the technical glitch there, but I just did a bit of acting. What 3 questions did you think of while I was speaking? Because one of the things that you will have to do in OET speaking is ask good questions, open-ended questions. You want to find out more information about the patient. Open-ended questions. Let me just check the chat. No one's written in the chat. That's cool. It was just a little activity. Cool. Another warm-up. I'm going to have to act again. Fine. This time, I want you to offer me some advice. Okay, I'm going to do a similar sort of thing. Listen carefully. And then I'm going to time you. I want you to then speak for 30 seconds. And I want you to give me some advice on my problems. So let me just get out my stopwatch. I'm going to speak. You're going to listen. Then you're going to speak for about 30 seconds, offering me advice. So here we go again. Let me speak first. Yeah, so I've been having a lot of trouble sleeping, actually. It might be because I'm so stressed at work. I'm a lawyer and I've got a lot of different cases that I'm involved with, probably overstretching myself. I work long hours, but I do go to bed quite early, but I don't know. I can't switch off my mind. I can't switch it off. I just sit there and I think about all the jobs I have to do. I try and distract myself and read and listen to music, but no, I usually stay awake until about 4 a.m., sleep until about 6, so about 2 hours, then I have to get up and go to work. And yeah, just been doing this again and again and again. Now I'm going to time you. You have 30 seconds to offer me some advice, starting now. Three, two, one. I in fact gave you 40 seconds there. Now, in OET speaking, it's not about speaking at extended lengths. You are there to listen to the patient and offer advice and ask good questions. In some instances, you should speak at length for like 30, 40 seconds maybe. But at other times, you might just ask a very short, simple question and say, tell me more about the pain. And so get them to speak as well. Anyway, that was a good little warm up. Let's now have a think about the OET speaking test in more detail. I want to sort of pick it apart so you can get a high score. So as you probably know, you have to do 2 role plays. So you're acting. I think this is something you need to understand, is that you're an actor here and you have to play the part. and you might feel a bit stupid, but don't feel stupid. Just get involved in the acting, okay? It's a little stage show. It's profession specific, so there'll be different ones for dentists, doctors, nurses, physios, etc. Cool, that's easy. You get 2 to 3 minutes to prepare. Fine. What does this mean? Well, this means that the interlocutor, the OET person, will give you the role play card, and you have 2 or 3 minutes to prepare. In which case, as I said, you can take notes. You can ask questions during this time. You can say, "Excuse me, I don't understand this note here, or this task rather. What does this mean?" And the OET person will explain it to you. If you're unsure about a specific word to pronounce it, you can ask the OET person, like Alzheimer's, for example. You say, "How do you pronounce this?" And they'll say Alzheimer's. So it's a bit of wiggle room to not cheat, but to gather some more information. Think about what you're going to do. I'll show you what I mean there. Then you have to speak for 5 minutes. You have to speak for 5 minutes. The role play rather, the two of you, you'll speak for 5 minutes. Medical knowledge is irrelevant. You're marked on how you speak, not what you say. Okay? So you're not being graded on your knowledge of technical, medical information or facts. They're not listening for the content of what you say. They're listening for how you say it. They're listening for your pronunciation, your oral fluency, your ability to listen and respond, that sort of thing. So that's a big weight off your shoulders. Let's have a close look at the role play card, because this is critical. So this is what you're going to see on test day. I'm going to break it down for you. This is the candidate card. So this is what you see. The OET person will be looking at a very similar card. There's the setting, there's the background information, and then there are the tasks. It's all important information. So understanding the setting, that's the first thing you should look at. So this one, it's a suburban general practice. Fine. Why is the setting important? Well, think about this. Imagine if the setting is the emergency room at the hospital. It's a very different setting to a general practice, right? You can begin to get a sense of the type of acting that you will have to do. If you're in an ER, for example, obviously it's going to be a little bit more stressful. You can probably imagine that the situation you have to deal with will be a bit more intense. That's fine. Then you have to understand the background. This is really important information. It tells you who you're speaking to and what the situation is. This one says, this 45-year-old patient is attending the practice after suffering a mild anterior acute myocardial infarct 2 weeks ago. Recovery was uncomplicated and the patient was discharged from hospital 4 days ago. He or she is now very concerned about the long-term process of recovery. Fine. So you're talking to a 45-year-old who's just had complications with heart surgery. They've been discharged 4 days ago. It gives you that background information on the person, and specifically that last sentence that says he is now concerned about the long-term process of recovery. So why is this important? Well, it gives you all the sort of necessary social information you need and the medical information. This is what is critical, the tasks. And you look at this and you think, oh my God, that's a lot of information. How do I do this? Well, I'm going to point something out to you, which is important here. Let me just get out my pen. Hold on, I want red. I want you to look at these first words of the tasks. You'll notice something about these, the first word of the task. Or the first couple of words, perhaps. Find out, advise, explain, reassure, provide recommendations. This is what the OET examiners are listening for. These are the do words. This is what you have to do. This makes it a lot easier because really you're just following those do words, those tasks from top to bottom through the 5 minutes. Okay? So let's look at them again. So find out. Let's look at this first one. Find out what is worrying the patient and be reassuring. There's another verb, be reassuring. Some fatigue is to be expected. It usually takes some weeks before full energy levels return. Next one, so you talk about that, then you move to the next one. You advise the patient of the importance of joining the cardiac rehabilitation program, blah, 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 blah. Next one, you explain the importance of exercise. Next one, you reassure the patient that his concerns are appropriate. Finally, you provide recommendations for prevention of future heart attack. Cool. Let's look at the patient's card. So we just looked at your card. What about the OET person who's sitting across from you? Well, they're looking at a very similar thing. And what you'll notice is that these two cards, these two task cards relate to each other. Let me show you how the doctor and the patient, or the nurse and the patient, how these two cards, these two role plays interlink, they connect. Okay, so let's read the patient's background. We just read that actually. We just read this one. This is the patient. So you're 45, you've just had a heart attack, blah, 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 blah. Here, this is what the doctor's reading. Sorry, other way around. We just looked at this one. So this 45-year-old patient is attending the practice after suffering from the heart attack. Fine. This is what the patient, the OET person, is reading. So you're 45 and recovering from a mild heart attack 2 weeks ago. You were discharged from hospital 4 days ago. You're unsure how much physical activity is appropriate and are seriously worried that the heart attack has left you dramatically weakened. You fear that the physical activities such as walking, gardening, or swimming might bring on another heart attack. The doctors have told you that another episode may be more severe than the first. So this one has more information than this one, but you can see that they relate to each other, okay? The two backgrounds relate to each other. What about the tasks? How do the tasks align? Well, as we found out before, the doctor has to find out, or the nurse has to advise or explain or reassure or provide recommendations. Fine. And so here the doctor wants to find out, and here the patient explains. Okay, here the patient asks something, here the doctor advises. Here the patient asks something, here the doctor explains. It's not a direct connection, but you can see how these two task cards relate to each other. Okay, so this is how the conversation, we step through the different tasks. I say something, the patient explains something, etc. So let's look at these two here. So the doctor wants to find out what is worrying the patient, and the doctor needs to be reassuring. The patient then explains something and expresses concern. So you can see how these two verbs relate to each other. That's just a little technical glitch. Let's get back to what we were talking about. Cool. So we're looking at how these tasks align. So let's read the patient's task. So the patient, the OET person, has to ask how much physical activity is advisable. And the patient has to admit your fear that any physical activity may provoke a relapse. So the patient admitting a fear. Then the doctor has to reassure, okay? So these verbs align. So ask and admit your fear links back to the reassuring there. Fine, that's cool. We can see how they connect. And here again, we can look at that. So when you're doing this, you can rest assured, you can be confident that your tasks align with the OET person's tasks as well. So how do we use the role play card? Well, as I said, there's a lot going on in this. So what we're in fact doing is we're reading the role play card, we're then speaking, we're then listening, we're then responding, then we're reading, speaking, listening, responding, and again and again and again. This is what you have to do. Now, On test day, you can hold that role play card in your hand. So what you'll be doing is you're reading, you're speaking, listening carefully, responding to the patient, reading again like that. That's the cycle that you have to go through. That's how you use the role play card. Now, one of the things that might happen during this speaking test, because it's a little bit chaotic, and you want to go like this. You want to do 1, 2, 3, 4, etc. down through the tasks. But sometimes it won't work like that, and you'll start out here, but then you'll miss one, and you'll go down and you'll miss this one, and you might go to here. That's fine, because what you can do after you finish this, you go back up and you can go back to this one here, for example. So if you miss a task, that's fine. Just come back to it at a later stage. Here's another critical thing that you should keep in mind. This is a real trick. Let's say you want to talk about a particular task. Like you can see here, explain the importance of exercise. Okay, let's say you want to do this one and it hasn't been done yet, and you're sitting there and you think that you want to explain the importance of exercise. What you can do is you can prompt the patient. So you can say to the patient, you want to talk about this. So you can say to the patient, can you tell me how much exercise you've been doing, or how regularly do you exercise? And then the patient will start to talk about exercise. Then you can come back and you can explain the importance of exercise. So this is what we call prompting the patient. We're basically getting the patient to talk about this, so then you can complete that task on the role play card. Okay? Scoring. Now, we want to know how we're scored. It's important. You're scored on 5 things, if I remember correctly: effective communication, ease of understanding, fluency, appropriate language, grammar and vocabulary. Let's look at them one by one. Effective communication. What does that mean? Well, communicate effectively. You need to be able to initiate the conversation, maintain the conversation, listen to and respond to the patient, ask open questions, respond to anything unexpected, and organize the consultation into stages. Let's look at what that means exactly. Initiate the conversation. So, if you're the doctor or the nurse, you'll say, hello, my name is Dr. Stein. How can I help you today? Or if you know the patient, you might say, hello, Mary. Nice to see you again. How's your mother? This all depends on the background of the patient, of course, because it may be a patient that you've seen before, in which case you will greet the patient and initiate the conversation differently than if you had not met the patient before. So it's up to you. You are the medical professional. You need to start the conversation. The other thing you need to do is maintain the conversation. You need to keep the conversation going. If the conversation dies, it's up to you to bring it back to life. One of the things the OET person will do is, if the conversation sort of stops, the OET person won't start it again. The OET person would just sit there awkwardly, because the OET person is waiting for you to restart that conversation and to ask another question, or to find or to complete one of those tasks. Okay? So you have to maintain that. So the doctor might say, okay, let's move on and talk about exercise, for example. That's one way you can maintain the conversation. Now, as I said before, you need to listen to and respond to the patient. This is critical. You need to listen to the patient. The patient says, I have a sore back, and you say, let's talk about your diet. That's not good. You need to say, oh, can you tell me where the pain is? So you've obviously responded to the patient. It's not your agenda. It's a conversation between 2 people. Don't ask closed questions. Do you exercise? Yes. Do you like exercise? Yes. This is a boring conversation. What you need to do is ask open questions. How often do you exercise? Maybe 3 times a week. What types of exercise do you do? I row once a week and I jog. You can see how asking open-ended questions creates a conversation. Closed questions, yes/no questions, are not good enough. You need to respond to anything unexpected. So perhaps you say this, okay, you will need to visit the radiographer. And then the patient says, how much will it cost? I'm broke. And you need to be flexible in your response and say, I'm not sure, but I can find out for you. So one of the things the OET person will do is ask you an unexpected question. Can I have the telephone number of that nursing home? And of course you don't know the number, but you're acting. And so you say, oh, yep, it's 579632. Or I'm not sure, but I can find out and I'll let you know. So respond well to anything unexpected. You need to organize the consultation into clear stages. Ideally, in the 5 minutes, you should introduce yourself. That will only take about 10 seconds. Hi, I'm Dr. J. I understand you've got some concerns about your heart. 10 seconds. You've taken that background information, introduce yourself. Or hi, Mark, it's good to see you again. I understand you're here because you want to talk about your mother. Introduce yourself, 10 seconds. Then review the background. That'll take 30 seconds. So you might say something like, I understand you've had an operation last week on your heart and there were some complications and you want to talk about those complications. Something like that. Just bring some of that background information into the introductory stage of your conversation. Then you go through each task, and that'll take about 3 or 4 minutes as you work your way through the tasks. Then, if you run out of time, most of the time you'll just hit 5 minutes, and that's fine. The OET person will ask you to stop at 5 minutes. But if you run out of tasks, here's a little tip, and it's a good tip. I want you to summarize the discussion, okay? What does that mean? You could say something like, well, anyway, thanks very much for coming in and seeing me. I understand that you have some concerns about exercise because of your heart, but as I said, it's fine to do mild exercise. And as I mentioned, it's probably okay just to do some walking around the block and possibly do some light gym work. Do you have any other questions? No. Okay, then you can stop. But a good way just to make up that extra 30 seconds at the end is to summarize. Ease of understanding. Ease of understanding refers to your accent, that you're easily understood, that you don't have a thick accent. You want to be easily understood by native speakers. Pronunciation, you say the words correctly. Things like word stress. Do you say information or information? Oops, I've spelled that wrong. That should be an M. Information versus information. My brother-in-law speaks Spanish and he says determine instead of determine. And it's a big difference when I'm listening to him. He says, I need to determine this. And I think determine, what's determine? Oh, determine. Big difference. He's saying the word. He's got all the spelling there. He knows the word, but the emphasis, the word stress is wrong. It's not determine, determine. And that makes a big difference in how I understand his language. So make sure you're getting that word stress correct. Fluency. Well, speak smoothly, speak at a moderate pace, not too quickly, not too slowly. In fact, I would say, if anything, speak a little bit more slowly than usual. Definitely don't speak too quickly. You need to resist umming and ahhing. It's a real temptation to go, let's try not to do it. You need to resist it. Limit restarted sentences. It's very easy and it's very common to start a sentence and realize that it's ungrammatical or it's not what you wanted to say, and then to restart that sentence. Try not to do that. Let's just do another little thing while we're here just to keep you occupied. I'm going to give you 30 seconds to read this paragraph out loud. Your time starts now. Okay, let me read it. And I'm going to read, as I said, at a moderate pace. What do we say? I'm going to speak smoothly. I'm going to read at a moderate pace. I'm going to resist umming and ahhing, and I'm going to not restart my sentences. I'm going to read a little bit more slowly than usual. And I'll say, a recent spate of unexpected mosquito-borne disease outbreaks, most recently the Zika virus, which has swept through parts of the Americas, have highlighted the need to better understand the development and spread of little-known diseases and for new strategies to control them, a new review suggests. The key to doing this well is to be conscious of what you're saying. Of course, the words aren't going to be in front of you. You need to think of the sentences. Concentrate on the words that you're saying as they appear, because you have a split second to make a decision about which word you will use to create meaning and to create that sentence. Think about, choose the right word. Choose the right word. Concentrate on what you're saying. Concentrate on listening. Don't be, concentration's the key, I guess. Appropriate language, appropriate. So use professional language. You need to avoid medical jargon. Again, it's not testing your medical knowledge. You're speaking to a patient, so you don't want to be too technical. Adjust your language for the patient. We'll look at this in a second. Adjust your tone for the scenario. Address the patient's concerns. So what does that mean? Well, use professional language. That means the doctor should not say, you just stick the needle in your arm. Because the doctor wouldn't say that, because stick as a verb, stick the needle in your arm, is probably the wrong verb. It's a little bit rough, I guess. The doctor should say, you should insert the needle into your arm. So that's more professional. What about medical jargon? Patient asks, how deep do I prick the needle? The doctor says, try for the subcutaneous area. No, that's not good. Why? Because the patient won't understand what subcutaneous means. The doctor should say, try for just below the skin. What about adjusting your language for the patient? Let's say the patient's a 21-year-old boy or 21-year-old male. How would that differ if you were speaking to a 90-year-old man? How would your language differ? So you need to adjust for the age of the patient, maybe the sex of the patient, maybe the background of the patient. I'm not sure. Maybe, well, let's look at tone, because this is interesting. Are you in the emergency room or the local clinic? How will your tone change? Is this an urgent medical matter or just a general checkup? Are you dealing with an angry patient or a depressed patient? You need to address the patient's concern. So the patient says, I'm very depressed at the moment. And then the doctor says, you should be happy. That's sort of inappropriate. You need to, the patient's concerned about the depression. So you'd say something like, I understand. That's hard. Address the patient's concern. Patient says, I'm very depressed at the moment. Whoop. Well, that's the right answer. Sorry. Grammar and vocabulary. These are just the language aspects. How good's your grammar? Well, the importance of verb tenses. Did you suffer from migraines? Do you suffer from migraines? Have you suffered from migraines? Are you suffering from migraines? Are you going to suffer from migraines? Had you been suffering from migraines? Is there another one there? No. You can see that these verbs have different meanings. Did suffer, do suffer, have suffered, are suffering, are going to suffer, had been suffering. These are all possible verb tenses that you will use in your speaking. However, they all convey different meanings. So this one just refers to a past fact, for example. This one, do you suffer from migraines? Currently. Have you suffered from migraines? In the past. Are you suffering from migraines? Now. Are you going to suffer from migraines? Future. Had you been suffering from migraines before you took the medicine? So 2 events, usually. So the verb tenses are critical. By the way, if you need help on verb tenses, check out our YouTube channel. There's a bunch of videos there on using verb tenses in your letter, in your writing, but it's also applicable to speaking. So do check those out. The importance of passive voice. Were you punched? So we rearrange the subject, verb, object here because we don't want to talk about who did the punching, because did your husband punch you could be potentially rude, and we want to be polite, and it might be irrelevant who punched whom. So what we do is we rearrange the sentence to make a passive sentence. You need to know where to put the emphasis. Articles. Have you taken medication? Have you taken the medication? Have you taken a medication? Well, let's have a little look at this. So this is just in general. Have you taken medication? I'm just asking about general medication, any medication. Here I'm talking about specific. So I use this article. Specific. And have you taken a medication? Well, that's just wrong. You can't make a sentence with a medication. Again, I've got another video in YouTube. You should check that out if you need help with the articles in your letter. It also applies to the speaking. It's on YouTube. Be specific. Cool. That's all. All right. Let's go to Q&A. If you have any questions, please type them into the chat. Payam, how do you talk differently with a 15-year-old boy compared to a 90-year-old man? Can you give me an example, please? All right. Let's say you've got a 15-year-old boy in your practice who has fallen off his skateboard, and he's a bit of a punk. He's got his hat on backwards, and he's a bit sort of, what's the word? Let's say he's a good word is recalcitrant. He's a bit naughty. He's a bit of a naughty boy, and he's a bit like, no, I don't want to talk to you. And you're sort of talking to him saying, oh, so you fell off your skateboard, did you? And, he might have a certain attitude. Okay, then you're talking to a 90-year-old man who, let's say he's fallen in the bathroom, and you say, oh, Mr. Peterson, I'm terribly sorry to hear that you've fallen over. You're going to adjust your language for each patient. So it's hard for me to give an example, but you can imagine that you would use slightly, only ever so slightly, just very slightly different language, and the tone of your voice will change too. And let's say the 15-year-old boy becomes rude, or he's a little bit like, and you say, Tom, I need to ask you a few questions. Please answer these questions. Tom, what happened? So you'll adjust your tone there. Marilyn, please advise how to approach the angry relative in the emergency room for waiting too long to be seen by a doctor. Right. So let's say one of the scenarios is that I think this is actually one of the OET official role play cards, that you're in the waiting room. You're a nurse. You're in the waiting room, and somebody says, nurse, excuse me. And you go over to not actually the patient, just a person. And the person says, I've been waiting for 15 minutes to see a doctor. My son's having an asthma attack. Okay, so this patient, the parent rather, is aggressive, angry. So how do you respond to that? Well, you respond as you would in real life. You say, I understand your concerns. I've spoken to the doctor. He's busy at the moment, but he will be with us very shortly. Can I get you a glass of water or something? And then the parent says, listen, my son could potentially die. And you say, listen, I've checked your son. He's fine. He's going to be okay. You need to relax. Please sit down. The doctor will be with you in a couple of minutes. Okay, so you just treat it like real life. Any other questions? Nope. What about on YouTube? Any questions on YouTube? All right, so we got some questions on YouTube. Will the examiners reduce the score if they ask them to repeat what they said? Good question. The answer is, if you misunderstood them because your language is not good enough, yes, you will reduce your score. If you misunderstood them because the examiner said something that was, or the OET person said something that was a bit mumbled, or you didn't quite understand, you can say, sorry, can you just repeat that again? and they'll say it again. So I think the examiners listening to the conversation will be able to determine what is a lack of your language skills, in which case your score will reduce, and what was just, sometimes in conversations we need to ask for clarification. That's just part and parcel. That's normal. What else was I going to say? It's important to keep in mind that on test day, the person you're speaking to, the OET person, is not examining you. In IELTS, the person sitting across from you is the examiner. But in the OET, what they do is they record the conversation. The person you're talking to is just another actor, so you shouldn't be nervous. They record that conversation, they send it away, the examiners then listen to it and give you the score. So on test day, you're not being examined. Sam says, sometimes I use pauses. That's fine, you can pause if you need to. Lisha says, so they can ask on any kinds of topic. Yes. Lisa says, are the warm-up questions counted? No, just the 2 role plays are counted. Sophie asks, is it necessary to ask the patient's name at the starting of the conversation? If the background information suggests that you don't know the patient, that's a good way to start. You could just sit there and you could say, hi, my name's Jay. Can I ask for your name, or can I ask what your name is? Or what's your name? Just keep it simple. My name's Tom. You say, all right, Tom, nice to see you. Now, I understand, Tom, that you're having some problems with your asthma medication, whatever it is. So that's fine. You can ask for the patient's name at the beginning. Cool. Will I be able to know the patient's name? Is it written in the card? It depends. It depends. Now, 2 things to be careful of, or 1 thing to be careful of, really, is you may know the patient. It'll say in the background on the card, this is a patient you've seen before, or a patient of yours, in which case you won't, you'll say, oh, Tom, good to see you again. Nice to see you again, Tom. Or this patient is presenting for the first time. Maybe it won't say something as clear as that, and don't worry too much about it, but in the background, it probably will give you some information of whether you know the patient or not. By the way, that's critical for your writing subtest. Do you know the patient or not? I wouldn't worry too much about it in this speaking one. Be flexible. Treat it like a real life conversation. You're just having a conversation like you would at work. That's what this is. You're just acting. No more questions? All right, I might leave it there. Thanks very much for watching. If you're on YouTube, do click like and leave a comment. It makes me feel good as a teacher. And if you need help with anything, then I suggest you do this. I suggest you check out this website if you need some help with your OET. Just go to www.e2language.com. That's a dot. That's a funny dot, but that's e2language.com. If you need any help with writing, speaking, listening, reading, grammar, pronunciation, any of that stuff, check out that website. We are the people to help you out. Thanks very much for watching. I'll see you soon. And I can't get rid of this stuff. How do I turn this off? See you guys.